So what is our overview of the evidence on traction? So we'll start with cervical. The exact amount of tension and the duration of the treatment isn't really defined in the literature very well. So there's a lot of trial and error within the parameters. In the randomized clinical trials that are out there, the group receiving cervical traction in addition to other courses of care didn't have any additional pain relief, loss of function, or disability. So it seems to be no better or no worse than other modalities. And it's for sure something that you'd always want to do in combination with active exercise, right? Most of the goals of our modalities is to facilitate exercise. Some of the controversies in the research with lumbar traction. So lumbar traction is not considered to be effective in decreasing non-specific low back pain. So if we don't have a very specific diagnosis of one of those conditions that we've talked about, right? So the stenotic intervertebral space, degenerative disc disease, a disc protrusion, impingement of the spinal nerves, things like that. If we don't have those diagnoses, then lumbar traction is not very effective for just kind of generic, non-specific low back pain. CT imaging indicates that lumbar traction does increase the reabsorption of the nucleus pulposa. However, the location of the protrusion does seem to affect the efficacy. So if it's straight out at the back or more anterior or more to the side, that seems to affect the efficacy of the treatment. But they need to do kind of some more research on that. And then a comparison of lumbar traction and isometric exercises indicated that neither of those interventions was more effective in decreasing pain or causing the or decreasing the pain caused by the disc herniations than a placebo treatment. So again, splitting those two things up indicated kind of no difference between them, but potentially combining them together could be more effective.